Hi everyone, welcome to week 2 post-surgery after my Achilles tendon rupture. Today I want to go over what the week's like for week 2. So we're going to talk about feeling in the ankle and the foot and the calf, the doctor visit, and also some tips to help you get through this week. So as far as feeling in the foot, throughout this week from day 8 to 10 is when most feeling started to come into the calf area. Started to get some twitching of the muscle and some cramps in the muscle. As far as feeling in the toes, that's normal again, improvement every day. And then the knee joint too, as far as movement, I can now extend the leg fully and tensor quad comfortably. So that's good progression as well. Around day 8 and 9, the incision did start to itch a little bit, but it was only uncomfortable for about a day or two and then it faded, so no real problems there. Also, I felt like the swelling had gone down on that foot too. Bear in mind you can't see because of the cast, but looking at the toes, it definitely looks a lot better than the week before. So definitely making progress as far as movement, as far as swelling and feeling in that injured foot. 14 days after the surgery is when I went to see the doctor. The best part about this visit was that we took the cast off, and this is what the cast looked like. So this is the angle that my foot was at, and this is the angle that your foot will be at. And the reason for all this, from my understanding, is so that your tendon back here is as short as possible, so it can work to heal itself. And then gradually, as the weeks go by, we'll work on getting our foot up again to move up and down. But for now, this is what the cast was on week 1. Now it's off. Once the cast was off, we wanted to make sure we had feeling in that foot. So make sure we can feel our toes, we can wiggle our toes, and we can feel at the bottom of our foot and the sole, and also around the ankle. Not only did we have our cast taken off, we also got the stitches out. So in total, there was 10 stitches for mine. It can vary depending on the length of the leg and the injury, and etc. There was 10 stitches taken out, which is fine, a little stinging, but nothing too crazy there. There is a little bit of bruising down on the foot, and that's perfectly normal. I've been advised by the doctor. So don't worry if you do have some bruising down there. Also, when the cast was taken off, about a couple of hours after that, I started to get a bit more bruising. And that's purely because the blood's now flowing a bit more. There's no restriction on that calf. So the cast is off, the stitches are out, we've checked for feeling, we've checked for infections, and everything looked good. So now we're moving on, and the doctor informs you to wear a boot. And this is what the boot looks like. Your boot may look different depending on what country or what doctor you see, but this is the one that I have. And there are 2 wedges or inserts at the bottom of the heel here that just Velcro stick on. And these are wedges that are important to keep our foot at that same kind of angle that was there in the cast. And as the weeks go by, from my understanding, we will take the wedges out, gradually work to get that range of motion back into the ankle. But for now, we're in this boot. Now, as far as the boot goes, you don't have to wear it all the time. It's recommended to wear it when you're moving about, when you're moving from room to room or going out the house. But if you are sleeping or elevating, you don't have to wear it. I do encourage you wearing it when you are moving around the house or going outside. The last thing you want to do is not have it on, fall or have an accident and damage the tendon again even more. About icing and elevating, and at this point it's really up to my leisure and how I feel. So if you feel like you got a lot of blood flowing down there, a little bit uncomfort, maybe pop your leg up and get some ice on it using the same methods as before, but it's not as regimented now. We don't have to do it every 3 hours for an hour. The doctor also mentioned that I'm now able to shower and bathe normally. The incision can get wet, so that's nice. We can now get in the bath normally without having to protect it with the sleeve. Now for some tips to get you through week 2. The biggest tip I can give you is to continue ice and elevating in week 2. Although you will feel much better than week 1, you may be tempted to stop some icing, stop elevating as much, but it is worth it and it definitely helps. Secondly, I encourage you to take things very slow and take your time with it and be patient again. Like I said, in week 2 you feel miles better than you did in week 1, but remember to take it slow and take your time with it. And that sums up week 2. A lot of positivity out of this week. We have the cast off, we have the stitches out, we're making the right steps to get back on our feet again. I'm looking forward to week 3 where we start our physical therapy and we start to get to move the ankle a lot more and more. So I'm excited for that. Thank you for watching this one, and I'll see you next week.